So, Wolf, we have just learned that former President George H.W. Bush, 41, who just buried his wife, First Lady Barbara Bush, on Saturday, has been hospitalized. We have been told that, unfortunately, Sunday morning, yesterday, he was admitted to Houston Methodist Hospital and that he is in intensive care. We expect more details to come out soon, but here's what we've learned. We have been told that he was suffering from an infection that led to sepsis, which can be life-threatening, that he was admitted to the ICU at Houston Methodist yesterday, and that, unfortunately, he has been struggling. We were told that he was in very serious condition. I assume if he's in the ICU that it was critical condition. We were told that his blood pressure kept dropping and that a couple of times there was serious concern about whether he was going to pull through. I'm told he's still being treated, is in the ICU, that he has been stabilized, but we're really waiting for an official report. Obviously, Wolf, at his age and his health concerns, he suffers from Parkinson's. With this infection, with the sepsis, this is very serious. And of course, all the more upsetting for his family, his friends, his staff, because it follows so closely on the death of his wife and the burial on Saturday. We were, doing the coverage on Saturday, and as I said to you on Saturday, everyone in his family is understandably worried about how he was going to deal with the loss after 73 years of marriage and such an emotional week. Of course, nobody expected this news this quickly. So we're waiting for more details, but he has been hospitalized.
You were in Houston at that funeral, Jamie, and you saw President Bush. You saw him up close, and we're showing our viewers some pictures of his son, the former president, pushing him along in that wheelchair. What did he seem like to you then?
Obviously, it was heartbreaking. I mean, when his son, former President George W. Bush, pushed him in his wheelchair into the church, there wasn't a dry eye in the house. And when his son, Jeb, read as part of the eulogy a love letter that he had written to Barbara on one of their anniversaries, you could see he was heartbroken, and it was awful. It just so hard to watch. But I'm told that actually Saturday night he went after the burial in College Station and had dinner with his family, and everybody thought that he was doing okay. And then Sunday morning when he woke up, there was this crisis, and they took him straight to the hospital.
Jamie, you know the Bush family very well. And I know you're speaking with some members, you're speaking with others close to the Bush family. How are they dealing with this, the fact that the former president, President George H.W. Bush, has been in intensive care at the Houston Methodist Hospital, suffering from this infection that has led to sepsis, which certainly can be life-threatening?
I think that the best way to describe it is that everyone is reeling. The family is, I haven't spoken to anyone in the family today, but I've spoken to people close to the family and friends, and they still haven't recovered from the passing of former First Lady Barbara Bush and are just coming to terms with that. So to have this crisis and bad news so quickly is very hard on everyone, both.
We all saw that picture, which is now iconic, of the 4 former presidents, 3 former first ladies, the current first lady as well, Melania Trump, there. You saw the big smiles on their faces. When you look closely at President George H.W. Bush sitting there in that wheelchair, Jamie, and this was, as we know, on Saturday, he looked okay, right?
He did. And let's not forget, Wolf, that on Friday, he, on his own, said, I want to go to the church when Barbara Bush, when the public was coming to pay their respects. He, on his own, said, I want to go to the church and welcome the public and thank them and greet them for coming, which was such a classic George Bush thing to do. It was the right thing to do, and even though his health has been very fragile and he's been in and out of the hospital a lot, he sat there at the church for quite some time greeting the public. So this was really unexpected, except for the fact that he's 93 years old. He's been in and out of the hospital. He has Parkinson's. And when he gets an infection, I think that it is much more dangerous than for most people.
We've just received a statement from the office of President George H.W. Bush. Jamie, let me read it to you and to our viewers. The statement coming out of Houston, quote, President Bush was admitted to the Houston Methodist Hospital yesterday morning, that would be Sunday morning, after contracting an infection that spread to his blood. He is responding to treatments and appears to be recovering. We will issue additional updates as events warrant. Well, that's somewhat a little bit encouraging, Jamie. He appears to be recovering. I assume he's going through major antibiotics to treat this infection, the sepsis, that could be life-threatening indeed. But they are saying he's responding to treatments and appears to be recovering. And of course, we wish him only the best. We hope he recovers completely, and they will be issuing further updates as events warrant. Well, what's your reaction to that, Jamie?
I think that is very encouraging news. I think that, look, I'm not a doctor, but my understanding is that sepsis can be very dangerous for someone of his age and health when you get an infection. Obviously, he's in the ICU. He is getting the best care he could possibly get. I think that in addition to the antibiotics and whatever fluids they're able to give him IV, that's, hopefully what's been stabilizing him. My understanding is the real concern yesterday was that his blood pressure kept dropping, and that seems, from the statement now, to not be such a problem that they have that stable. But I think we're just going to have to wait for more reports to come in over the next couple of days.
Are the Bush family members still in Houston, as far as you know, Jamie? They were all there Saturday, clearly, for the funeral.
Right. So some of them live there. Neil Bush and Maria Bush live actually right across the street from former President Bush, so they're there. I understand that their daughter, Dora Bush, is still there, but I think some members of the family had already gone home. So there is family around him.
Dr. Sanjay Gupta, our chief medical correspondent, is joining us right now. Sanjay, I know you're very familiar with this infection that led to what's called sepsis, and the statement from the office of President Bush saying it has spread, the infection has spread to his blood. Tell us about sepsis and how serious a problem this is, the president in intensive care at the Houston Methodist Hospital.
Well, it's very concerning, obviously, and Jamie outlined it pretty well there. We know that he's had these infections in the past. We know that he's obviously dealt with some other underlying illnesses, was in the hospital last year as well. What sepsis is typically is an infection that has spread more widely, typically into the bloodstream. And what happens as a result of that is that the body reacts by trying to fight the infection, and that can cause someone's blood pressure to drop, their heart rate to become unstable, and that's typically what leads to the not only need for hospitalization, but need for intensive care, being in the ICU. At times, it can also interfere with one's ability to breathe well on their own, necessitating the need for a breathing machine. So that's all, that happens real time and pretty quickly. Those assessments being made in the intensive care unit, obviously compounded by his age and his other underlying medical problems.
Yeah, I was going to say sepsis is awful, and I'm not a physician, but I've heard enough about it for any age, even if you're young or middle-aged. But when you're 93 years old and you have Parkinson's, it could be really, really bad.
Yeah, that's exactly right. You sort of count on your body to sort of have enough reserve to both fight the infection and in some ways be able to deal with your own body's response to the infection, meaning that your blood pressure may start to drop, your heart rate may start to become erratic, and if you're otherwise healthy, your body can sort of, if you will, accommodate these changes, keep up with these changes. But as you get older, it does become harder. If you have underlying illness, it becomes harder. You have to decide how aggressively you want to treat this infection. If it's a bacterial infection, what types of antibiotics? What are the side effects of those types of medications? And what effect might they have on the other organs in the body, the heart and the lungs specifically?
He's in intensive care right now at the Houston Methodist Hospital, and the timing is so sad, coming so quickly after the funeral. The office of President George H.W. Bush saying he contracted this infection that has spread to the blood. Is there any way of finding out how someone contracts an infection like this that spreads to the blood that results in sepsis?
Well, it's interesting. I think there's 2 points here. One is, the actual contracting of the infection, and people can get infections in all sorts of different ways. Someone who is not as mobile can get infections just from pressure ulcerations, for example. But the other part of it, and I think the part that is you're alluding to, Wolf, is that then your body sort of tries to fight that infection. And why does an infection that might otherwise be not as serious turn into something serious? Because your body hasn't been able to fight it as well. Your immunity is compromised, and right after a big loss, certainly like he has had, there is some data to show that people can develop problems with immunity, become more susceptible to infections, have otherwise infections that they would have otherwise been able to fight become more serious. So it could be a combination of these factors, Wolf.
Yeah, clearly he was heartbroken by the death of his wife, Barbara Bush, of 73 years. We could see that on his face. But you make an important point that the combination of the heartbreak plus the infection. They're dealing with it right now. They're dealing with it with heavy doses of antibiotics intravenously injected, right?
That's typically the course. So what you have to do is you are suspicious that it's sepsis because someone is having trouble with their blood pressure, their heart rate, whatever the clues are, and then typically you will take some blood to try and figure out what is causing the infection, what is the pathogen, if you will, and then based on that, you select the appropriate antibiotics. It's a balance because, again, you want to give strong enough antibiotics to fight the infection, but not so strong that it somehow will harm other organ systems or make it harder for him to maintain his blood pressure. So there are several different factors at play, and again, an intensive care unit, a place like Methodist, one of the best in the world, those are probably the real-time decisions that are going on right now.